You know, we can move those a little closer together now because I think that's yours.
Oh, I didn't even see it, Governor.
Second level.
I'm in the balcony.
So good morning. We're pleased to be here in Chelsea today to highlight a new mobile vaccine clinic bringing vaccines to some of the communities that were hit hardest by the pandemic. I think as most people know, Massachusetts is leading the country with respect to vaccinating our residents overall. Almost 3.7 million people here are fully vaccinated and over 4.3 million people have had at least a first dose. 79% of all adult residents and almost 2/3 of all residents have received at least one dose. That makes us number one among all states with more than 5 million people. I think as most people also know, vaccines are widely available across the state at over 900 locations. The vaccine's free. You don't need insurance or an ID to get one. As we get closer to that goal of vaccinating over 4 million residents with 2 shots, we've been ramping up targeted community outreach efforts to reach the remaining residents who still remain unvaccinated. We've expanded our homebound vaccination program, probably done about, how many of those do you think we've done? 30,000 maybe?
No.
20,000?
About 15,000.
15, okay.
15,000.
Well, 2 shots, right?
Yeah, it'll be 30,000 if they get the second shot.
Yeah, okay. About 15,000 home visits for vaccines, and we've also continued to remove barriers to getting vaccinated. Generally, we've set up employer vaccination programs as well as school vaccination clinics, and that obviously brings vaccine right to folks in their workplace. And we've also launched creative partnerships with Massachusetts organizations to help get more people vaccinated, like the Family Vaccination Clinic over the weekend at the Museum of Science and Duncan Days at the Heinz last week. And I think if you go to the Woo Sox game today in Worcester and you get a vaccine, you get in for free. We've increased our mobile clinics in some of the hardest hit communities, and over 200 mobile vaccination clinics have been held so far in 16 communities. Today we're announcing a series of new mobile vaccine clinics hosted at several market basket parking lots across the Commonwealth. They'll launch tomorrow in 5 communities here in Chelsea, in Fall River, in Lawrence, Lynn, and Revere. The mobile sites will be available Thursday, Friday, and Saturday this week, and Thursday, Friday, and Saturday next week, June 10th through 12th. The full schedule will be posted at cichealth.com/marketbasket. We continue to spread the word with respect to community partners to help us get out the word on vaccine clinics, and next week an Everbridge alert will be sent out to the 5 communities where these market basket mobile clinics will be held to make sure people have a chance to take advantage of a vaccine in their backyard. I'm also told that Bob will be doing live announcements while the vaccine clinic is running for folks who are shopping here in the stores. And thanks, Bob. I really appreciate you doing that. We look forward to hearing that Celtics, Bruins, Fenway Park type voice here at this store. And everyone who gets a vaccine at Market Basket, the Commonwealth will give them a $25 Market Basket gift card that they can use in the store. Vaccines are available via walk-up. Nobody needs an appointment. I want to thank Market Basket for generously hosting these clinics on their properties. We know these are convenient community locations. They're very heavily traveled, as anybody who's ever been to one knows. And we encourage all residents to come down and get their vaccine while they're doing their shopping. While we've made great progress in vaccinating our residents, we know there's still a lot more work to do. And that's why we've invested about $30 million in our vaccine initiative to address vaccine hesitancy and increase access to vaccines in our 20 hardest hit communities. We've provided funding to over 120 community-based organizations in these communities to help with these efforts. We've launched grassroots canvassing efforts to go door-to-door in communities to answer questions people may have about vaccines in multiple languages and to help sign them up to get vaccinated. These canvassing teams so far have knocked on about 234,000 doors and made almost 30,000 phone calls. That includes almost 7,500 doors knocked here in Chelsea, and the teams have also held 40 community outreach and visibility events in Chelsea as well. We've also been sending out, as I said, targeted text and phone messages to residents in disproportionately impacted communities to remind people of the importance of getting a vaccine, and we share locations in their communities where they can get vaccinated. And so far, we've sent out messages to over 1.1 million residents of those 14 communities, and we're continuing to work to reach those communities as we move forward, and we'll also be reaching out to folks in those other most disproportionately impacted communities as well. Our goal remains to give everybody who wants a shot an access to it. And at this point, it's easier than ever to get a vaccine. As I said, there's more than 900 locations statewide. If you haven't gotten vaccinated and you want to get vaccinated, you can visit mass.gov/COVID vaccine to find a location that's convenient to you. And I can't say this enough, it's very clear based on everything that's happened here in Massachusetts since people began getting vaccinated back in December, that the vaccines do save lives, and they are a big part of how we got back to normal. Get vaccinated to protect yourself, get vaccinated to protect your friends, get vaccinated to protect your family, get vaccinated to protect your neighbors and your communities. Thanks very much, and again, thanks very much to Market Basket for stepping up and letting us take over some of their turf to run these programs here in Chelsea, Lynn, Lawrence. Questions?
Governor, has the state done any outreach to find out exactly why some folks are not taking the vaccine? You know that there's a gap, but you know why. Are you asking them why aren't you getting?
Yeah, there's a ton of data at this point that we've collected, that other organizations have collected, and that the federal government's collected as well. And generally speaking, there are a number of reasons why folks who haven't gotten vaccinated haven't. Some folks haven't gotten vaccinated because they've had COVID, and they don't think they need to get vaccinated if they've had COVID. Some folks haven't gotten vaccinated because they're young, and they don't view COVID as a problem among people who are young. And their parents and their grandparents at this point have gotten vaccinated, so they're a little less worried about the issues associated with the older folks in their family. Some folks haven't gotten vaccinated because it hasn't been approved by the federal government formally. In fact, there's a significant number of people who said in a poll national poll that was just released yesterday, that a federal designation beyond the emergency use authorization, that an actual full authorization of the vaccine would make a big difference for a bunch of people who've chosen so far not to get vaccinated, to get vaccinated. And some people simply are concerned about the fact that nobody does know really the answers to any of the so-called long-term questions associated with vaccines of this kind, because they are new and they were developed relatively quickly. What I would say in response to that is here in Massachusetts, we have watched week over week over the course of the past 5 months as the more people got vaccinated in Massachusetts, the fewer people got sick, the fewer people got hospitalized, and the fewer people passed away. I mean, it's literally the vaccine line went like this, and the hospitalization, case counts, and death line went like that. And we now have roughly 90% of the folks over the age of 75 in Massachusetts who've been vaccinated. And we have had tremendous improvements in our case counts and our hospitalizations across that entire population, which I think is a pretty clear indicator right here in Massachusetts that these work. But there's a bunch of different reasons why people have chosen not to.
Any idea why there's still a gap between white residents and black residents? White residents are getting vaccinated in a higher rate. Why the disparity, and what can the state do to address that?
I think the biggest thing the state can do to deal with some of the issues around the disparity in vaccination rates between white residents and people of color is literally to continue to recognize and understand that we need to make this available anywhere and everywhere we can. And that's a big part of what this initiative's about. It's a big part of what the mobile clinics and the pop-up clinics are about. It's a big part of what the programming that we're going to continue to do in those 20 most disproportionately hit communities will be about. I do think one of the issues that factors into this is a lot of folks in those communities got COVID. And for a lot of folks, if you had COVID, that's viewed as, I'm okay. I think one of the things we've tried to sell to people is that while there's certainly some immunity that comes with having gotten the virus, you get a bigger and more important, sort of longer lasting benefit from actually getting vaccinated.
Governor, the legislature is moving to take some of the, or take all of the $5.3 billion in federal funds coming from the ARP, and take control of that fund, put it into a separate account, which would require a public process. It seems like your office is pushing back on that. Why is your office pushing back on that? And can you tell us if Massachusetts has received those funds already?
Yeah, we got the money a couple of days ago. I think there are two issues there. One is, first of all, there's a time frame and a time limit on a lot of those funds. You know, some of them you can spend until a certain date in 21, some in 22, some in 23. So it's important that we recognize and understand that we need to put this money to work relatively quickly. The second thing is, let's take the $100 million that I thought we all agreed we were going to give to places like Chelsea and Everett and Methuen and Randolph, all of whom were horribly under-reimbursed under the federal ARPA program. We have 351 cities and towns in Massachusetts. 347 of them have gotten their money, right? There are 4 communities that haven't, one of which is Chelsea, and all 4 of those communities are communities that were really hard hit by COVID, and they're exactly the kind of communities that deserve our support. We would have just moved ahead and put the money out. We're going to have a conversation, obviously, with the legislature and say to them, you know, do you really want to treat these 4 communities differently, or should we be doing exactly for them what is actually going on for the other 347?
But if you have the money already now, and there's nothing preventing your administration from rolling out those funds, why not just do that now? Is that $100 million ahead of the legislature?
The legislature put out a press release. They made a point with respect to this. It wasn't 5.2 million, it was 5.3, okay? We'll raise this issue with them. I hope they see it the way we do.
Last question.
Governor, your thoughts on, obviously we've seen packed stadiums, Fenway,
Yep.
the Garden. Just your thoughts on that, and specifically, I'm sure you saw the incident with the kid throwing the ball at Kyrie Irving, beating that. Just your thoughts on, you know, how fans should react when they're in stadiums, and your thoughts on seeing that incident, and then overall, you know, just be able to see a packed Fenway and your thoughts on seeing that on TV.
Well, one of the things that the CDC has said, based on all the data that they've seen, and this has been something other public health agencies have said for a while now, is that outdoors, the likelihood of transmission outdoors is really low, okay? So whether you're talking about Gillette, or you're talking about Fenway Park, or you're talking about you know, other outdoor venues, there's very little evidence of significant transmission in those environments anyway, because obviously they're pretty fully ventilated. I think the fact that almost 80% of everybody who's over the age of 18 in Massachusetts has had 1 shot, and north of 60% of those folks have had 2, is a pretty good indicator that the vast majority of the people who are going to show up in most places in Massachusetts, including a place like the Garden, are vaccinated, or at least have 1 shot. And that makes it very hard for the virus to basically move. And remember, you know, it only lasts for 14 days. The way it survives is by jumping from person to person to person. If, you know, 6 out of 10, 7 out of 10 of the people who are at an event are vaccinated, it's really got very little place to go. With respect to the incident, obviously, I was glad that the folks at the Garden acted so quickly, figured out who the young man who threw the bottle was, worked with the local PD to have him arrested. I think he's going to be arraigned later today. I mean, look, no one should ever throw anything at anyone, fan to fan, fan to player. You know, you're automatically putting someone in danger when you do that. And fans, you know, fans should be fans. Fans should root for the home team. They should root hard for the home team. They should do everything they can to make noise and create that adrenaline rush that athletes talk about when that type of thing goes on in a venue. But, you know, they should never throw anything at anybody. And I'm glad they found him, and I'm glad they arrested him.
Governor, your comments and thoughts about Dr. Burrell stepping down from health?
So Dr. Monica Burrell came in as the Commissioner of Public Health with our administration. I think she was she might have been one of our first hires at Health and Human Services. And that is a tough job, okay? The Commissioner of Public Health in Massachusetts does not usually stay in that job for as long as she has. In fact, I think she's probably the longest serving public health commissioner in Massachusetts in probably 20 years, maybe more. I think she did a terrific, her background as a public health doc and as the chief medical officer of Boston Healthcare for the Homeless before she joined administration meant she brought to the job a sensibility and a set of relationships with local community-based healthcare providers who work primarily with some of those populations that often get overlooked. Was a really important voice in terms of how we organized a lot of the work we did across a wide range of activities. And obviously one of the things that she brought to our attention and made us one of the first states in the country to really take a hard look at this was the whole issue around the lung damage that was being done by vaping and the impact that vaping was having on addiction rates among young people. The COVID issue, I think, for all of us has been, I said last week, it's been a really long year, I think, for everybody. And I wish her well with whatever she chooses to do next. But I think she did a terrific job.
Several individuals and organizations at this point are asking for you to offer an apology, a public apology to Francisco Urena, saying that he was scapegoated in light of some of the new reports that have come out on the polio soldiers' home outbreak. What is your reaction to that? And do you think that maybe you should do premature after the investigation?
So I said at the time when he resigned that he was a fabulous voice for our veterans here in the Commonwealth of Mass, and obviously served honorably as a member of the Marines. But the report that was done by Mark Perlstein, as well as other reports, indicated that we had a supervision issue with respect to the soldiers' home, and we accepted Francisco's resignation. I wish him well in whatever he chooses to do next.
Thanks, everybody.
Thanks, guys. And thanks again to Market Basket.